Hello, everyone. Thank you so much for coming to our webinar today. My name is Rosie, and I am an examinations contractor here at the Ophthalmology Foundation. To start off with, I'll just give you a quick overview of the Ophthalmology Foundation and then let the rest of our panelists introduce themselves as well. And then we can go from there. Nicola and Dr. Cuckoo have both have presentations ready as well to discuss with you all, and then we'll move on to our live Q&A section of the webinar. So just as a quick overview, like I say, the Ophthalmology Foundation aims to improve global healthcare worldwide through education, specifically in under-resourced countries. And the Ophthalmology Foundation has been in operation for the past 5 years. We run several programs in education, fellowships, and then our current new initiative, which is our examinations. It is very much an international organization with a board of directors worldwide, as well as our specific examinations committee, which is also a global group. So Nicola and Vicky, if you'd like to introduce yourselves.
Thank you, Rosie. My name is Nicola Quilter, and I'm the Examinations Director for the Ophthalmology Foundation.
My name is Vicky, and I am an examinations contractor for the Ophthalmology Foundation.
Thank you. And Dr. Cuckoo, if you'd like to introduce yourself as well, please.
Thank you, Rosie. Good afternoon. My name is Kuku Prasetyo. I'm ophthalmologist from Central Java, Indonesia, and I am one of the member of Young Ophthalmologists Perdami. Thank you.
Great, thank you. So I'm going to hand it over to Nicola, our director, to give you a bit more information about our examinations. Thank you, Nicola.
Thank you, Rosie. And thank you everyone for attending today. It was really, it's going to be a really good session, and hope you come out with a lot more information. And if you have any questions, obviously we're here to help. So the Ophthalmology Foundation examinations are more than just written exams. They are globally respected benchmark of knowledge and excellence. So they help ophthalmologists at every stage of your career to demonstrate your expertise, gain recognition, and build confidence to deliver better care to your patients. So you're probably thinking, why take these new exams? So we run these exams because they serve several critical purposes. They set and maintain high standards in ophthalmology across the globe. They benchmark the knowledge and expertise of professionals at all levels, supporting your career progression. And most importantly, we believe that patients in turn receive the best possible care. And that's what we're all aiming for. So what we offer, the examinations are structured into 3 sections. We have visual sciences, which is 120 questions, optics, refraction and instruments, which is 60 questions, and clinical ophthalmology, 160 questions. All use a single best answer format with 1 point per correct answer. And you'll be pleased to hear that there's no negative marking. So if you are unsure of a question, my recommendation would be to leave it and then go back to it. And if you're still not sure, then take a guess, an educated guess, because you're not going to lose a point for it, but you actually might just gain one with it, which will help obviously towards your pass mark. We also offer exemptions for visual and optics sections for eligible candidates. So if you've passed the ICO, for example, visual and optics, you can move directly on to our clinical exam. The exams are matched to the BCSE curriculum, and we also provide a suggested reading list and materials via our website. And the reading list includes free books, leaflets. It includes a really good suggested website on glaucoma, which is a video, quite interactive. So also, if the BCSE is quite expensive, we're not saying you need to go out and purchase that. So we understand it's a cost, but we actually provide lots of reading material around BSc and BCSE that will help you prepare. In addition, we're also collaborating with CyberSite and to create a dedicated preparation portal to support candidates further. That should be available within the next 9 to 12 months, if not sooner. And I think if your society or ophthalmology, a young ophthalmology society, collaborate with the Ophthalmology Foundation, then that will be available sooner. So how the exam works, the exams are delivered fully online. So this makes them more accessible to you, wherever you are in the world. And each candidate can sit the exam in a controlled room in their own country, monitored by a human proctor who is physically present at the time. And so that would be your senior in your institution. On top of that, there's also an advanced AI platform which detects movement, noise, and any inconsistencies. So it's a really robust system that's provided by human proctors and the AI. The exams are offered twice yearly, March and September, and the next exam is on the 24th of March, and the closing date is in July. And currently, it's available in English, Chinese, French, Spanish, and Portuguese, and we're exploring Vietnamese. This combination of accessibility, multilingual delivery, high integrity makes our exams rigorous, fair, and trusted. So the benefits of our exam are significant. They're internationally recognised, yet cost less than any comparable exam. So if you look around, so examples are ICO, the American Academy, the Ophthalmology Foundation makes sure that the fees are affordable so that it's open to anyone around the world. It can also be taken in your own country. So also that helps that you don't have to travel, because obviously that incur another cost, flights, trains, accommodation. So we kind of bring the exam to you. But we also scale our fees, which are based on the Wellbeing Bank Index. And as I said, that makes it fair for everyone. Candidates also earn points towards an IOF fellowship application. And each year, the highest scoring clinical candidate across both sittings combined has the chance of winning the prestigious 10,000 David and Molly Pyatt Award. We had a candidate this year who trained in Ethiopia and took the exam in Rwanda, and he was the top passing candidate. And it was a great pleasure to be able to phone him and say that he was, and that he had achieved he received the David and Molly Pyatt Award. And I believe he's using his to travel to the American Academy meeting next year, and then on from there, do some work in America. Host also benefits. So joining our global community, benchmarking the trainees, and receiving an honorary FIOF, which after 5 years of hosting becomes a permanent fixture. So applying for the exam, when it comes to applying, our tagline says it all, basically. We bring the exam to you anywhere in the world. You can apply and make payment easily online through our secure portal. And if you go to make payment as well, we do understand that this can be quite a big fee for someone in training. And what we've just implemented is a 3-way payment system. So you can go online, you can register for the exam and make the first payment. And the first payment is 1/3 of the total amount. In a month's time, you'll get an email from us and to say your second payment's due, and then subsequent to that, a third email in the following month to say your third payment is due. So it spreads the cost, which we hope will obviously help with finances. You also from the portal, you can select your desired location. And if you can't see that, then you can type other and put in where you'd like to take the exam. And we do our best to match your request. We're actually really successful in doing that, I'd like to say. And from the March sitting, September sitting this year, we managed to make sure that everyone took the exam in their desired location. As I mentioned, our fees are based on the World Bank Index. And so what that does is affordable while remaining significantly lower than other international exams. So we like to partner. We're not a membership organisation, but our impact is strengthened by our partnerships. We work with prestigious organisations like Wilmer and Wills Institute in the US, the African Society, more recently COEXA, the PAO, the Young Ophthalmology Society of India. We're also building strong new relationships with the Turkish, Mongolian, Nigerian, and Indian, Pakistan societies. And we're continuously seeking new collaborations with societies, organisations to further strengthen our global reach and impact. And these partnerships, we believe, help expand our reach to you, ensure relevance, and build a strong global ophthalmology community. So our committee, we have a board of directors, and then we have our exams committee. And at the heart of our exams committee is our international exams members for all over the world. They ensure our exams remain globally relevant, fair, standard setting using ANGOF method. And they produce questions as well. So we also have a pool of question writers, which are international. And what that does, it makes sure that the exam questions are relevant to your region. So that obviously visual sciences, basic sciences is something that everybody needs to know, but then we make sure that it's regional specific. Exams are marked online and results are released within 2 weeks. And actually a testament to Rosie and Vicky and the team, the results for the September exam were released within 8 days. And what that does is it stops you worrying. because there are some exam boards that take a longer process. And I think, that causes stress and angst and worry, but we aim to get them out within 2 weeks, but this time we did it within 8 days. In fact, the exams already made a real difference, and many candidates in dozens of countries have taken these exams, and I think that's advanced their careers and raising standards worldwide. In many undeserved regions, they're helping ensure patients receive better ophthalmic care. I've met a few candidates, successful candidates, at the American Academy this year, and one said that passing the exams opened doors they never thought was possible. So there's lots of opportunity with taking and passing these exams. I think looking ahead, we have ambitious plans. We aim to reduce costs even further. So we're not looking to make any money. We're looking to be able to put any surplus money back into the system and reduce the fees. We're also looking to add more partners globally, increase access to undeserved regions, and expand our offering with additional fellowships and subspecialty exams. We're aiming to introduce subspecialty in retina and glaucoma for the September 26 sitting. Also, we listen to our candidates and our colleagues. So if you have any feedback or ideas or what you'd like to see in the future, then obviously let us know. Your input helps us to continue evolve and improve our systems. So we like to hear that. In summary, the Ophthalmology Foundation exams are at the heart of what we stand for, setting up and holding the highest standard in ophthalmology, empowering you as professionals to grow, and improving outcomes for patients around the world. Every candidate who takes our exam becomes part of our global community, committed to excellence in eye care. And what I will say is such an international exam that actually trainees are meeting other trainees. And I think a good example of that is that we had a trainee that was taking one of our fellowships and was doing a study and contacted us and said, I need to send out a questionnaire. I need to reach as many people as possible to get as much information back. Can you help? And I think we did a few weeks ago. We sent out a questionnaire via our contacts, and I think he's had so much response from everyone. It's been overwhelming, but it just brings the community closer together. We're proud of what these exams have achieved so far, and I'd like to say we're determined to make them even more accessible, relevant, and impactful in the years ahead. So I hope you got some information from that, and I hope you've got some questions as well. But thank you for listening.
Thank you very much, Nicola. And as you said, if anyone does have any questions, please feel free to put them into the chat and we will have time at the end to run through them. Dr. Cuckoo, I will hand it over to you. I will just share my screen if you bear with me for 1 minute.
Okay.
Can everyone see my screen?
Yes, clearly.
Great.
Thank you, Rosie. Today I would like to share my own experience in taking this test. This is a training opportunities for Peldam Young Ophthalmologists, or YO, Indonesian Ophthalmologist Associations. Slide. Sorry, Rosie. Okay, thank you. Young Ophthalmologists is a collective group of Indonesians board-certified ophthalmologists under 40 years old and all have less than 10 years of clinical experience after graduations. Slide, please. It is actually initiated back there in September 2019 in annual meeting of Indonesia Ophthalmologist Associations held in Makassar, but it is officially acknowledged by Perdami. Next, please. In 2020, with head of department of YO is Dr. Ali Arianti. It has 3 subdivisions, including media and website, fellowship and education, and also art and music, culinary and photography. I need to emphasize the fellowship and education that being held by Diah Ayuwindi, medical doctor. Next, please. This is several activities that we have already held. First of all, as introductions, YO, and then YO Fellowship and Education Survey, followed by, next please, followed by Yes, Fellowship for YO in Indonesia program perspective that being held online during the pandemic of COVID. And then we had also YO launch. Next, please. With mentorship program being held in Apau in Bali, 2024 maybe. And then we also have joined YOSI for World Music Days with musical performance, and then several panel and discussions. Next, please. Including about activity of YO. Next, please. Uh, so YO is a place where we can share our opportunity to another member. So I need to introduce this kind of opportunity, which is, as Nicole has already introduced to you all, is online international examinations held by Ophthalmology Foundations. It is actually an examinations about examinations consists of 3 parts: visual science, optic reflection, and clinical ophthalmology. It is aimed for ophthalmologists and young ophthalmologists. Apart from another examinations, it a bit lower cost of twice yearly, which is held in March and September. Sorry, next. Advantage of taking this exam. Next, please. Advantage of taking this exam. This exam is held online, so it can be done in any countries. In Indonesia, it is held on Jakarta and West Java, Bandung, recognized by international standard of excellence, gain points towards fellowship programs. Another advantage, it for those who can passing the 3 tests, it can have a post-nominal fee of or fellowship of International Ophthalmology Foundations. In my humble opinion, it is financially more affordable compared to another examinations because it's held online and it can be done in our countries. It didn't spend any papers and so. And the result will come earlier compared to another examinations. And no mention more about the opportunity to have Molly and Piot award for those who pass the clinical examinations, the top grade. Next. Well, actually, there is one member of YO Indonesia that has already awarded for International Ophthalmology Foundations. It is Desti Priani, medical doctor, who spent about 3 months observership in November 2024 to January 2025 in Royal Free Hospital in London. So I guess these examinations will open our opportunity for taking advanced part in our career. Next, please. It is not so easy for me to take the part because this part I took these international examinations way after I graduate. So there is a moment where I didn't pass the test. I failed for my test, and well, actually, it bring me back a bit. So Nicole, Sarah, and Juliet and I will share our how to manage if I did not pass the examinations. You can read it out in Community Eye Health Journal. From setback to comeback, navigating eye exam failure in medical training. You can Google it up, I guess. Next, please. So I encourage all the YO member to take international examinations as a part of your career ahead, so you can open any opportunities to international of fellowship and education. Thank you.
Thank you very much, Dr. Kuku. That was great. Thank you. We are now moving on to our Q&A portion of the webinar. So Vicky, if you wouldn't mind running through those questions for Nicola.
Yep. Thank you, Rosie. So the first question we have is there any mock exams for practice?
We don't currently offer a mock exam for practice. That is something we're working with CyberSites, so that will be in place in the next, hopefully, 9 months. However, we could, and it has been discussed, provide questions via the website, and I think we're looking at doing that so that you can look at the type of format of question. It will provide you with the answer after you've reviewed the question, to give you some idea of like the format and how it works.
Thank you. Are the previous ICO examinations, i.e. anatomy, physiology, optics, can they still be used as exemptions for the OF exams?
Yes, so if you've passed the visual sciences and optics and refraction prior to and including 2022, then you're exempt from our visual and optics exams and move on directly to the clinical. The reason why it's up and inclusive of 2022 is because we know then and believe that we had contributed to the standard of the ICO exams then. After 2022, we were unsure of the standard, and therefore could not say that it's comparable. So unfortunately, after 2022, we do not offer reciprocity or exemption, sorry.
How many types of OF exams are there? And will it only be the written test, or will there be an interview, OSCE too?
No, there's no plan to do a written. What we are written, well, no plan to do an OSCE, sorry. We are purely written exams. We have visual sciences, optics and refraction, and clinical ophthalmology, and we're in the process of implementing the subspecialty exams. So from September 26, we'll have retina and glaucoma, and then from March 27, we'll introduce another two. So it'd be a staged process, moving through the system.
Thank you. How do candidates enroll for the exam?
If you go onto our website, which is www.ophthalmologyfoundation.org, you will find, we could also send you a QR code. You can actually be directed there through to the online portal. You can apply on there, you can set up a profile, it asks you to put your photograph on, upload your certificates. I think, Cookie, you've done it. It's a simple process, isn't it? And then you can apply through there. And then that's also where the payment system kicks in. So if you wanted to spread the cost over 3 months, then you can go through that process as well. I think that's a great system, and it's new, and we wanted to help, spread the cost, and we didn't want a system. I think we use something over here, I think it's world known, Klarna. But we wanted to use something that's integrated in our system. So I think it's a great opportunity. We've had lots of positive feedback about spreading the cost over 3 months. I think it just helps. I think if you got to one of the months and was also unable to, then we can stall it for, so you have a break. I think it's just a great process that you haven't just got one blast of payment, because, we understand that you've got commitments, you've got families and, other commitments of education. So it's it's a really positive experience, 3-way payment system.
Thank you. If a candidate has passed the FRCS Glasgow Part 1, can they proceed straight to clinical ophthalmology exam?
Yeah, so if you've passed the Glasgow exams and you've passed the Edinburgh exams, then we offer exemptions. You can move to the clinical exam. We actually are looking for reciprocity with Glasgow and Edinburgh. And I have a meeting. I'm flying to Glasgow tomorrow with David Pyatt, who's the Vice President of the Ophthalmology Foundation, and we have a discussion with them. So we're looking also, as I said, we're not about you taking more exams. If you're got an exam that's comparable, and we believe it's the same standard, then you can move through our process slightly quicker. So it's positive. We offer exemptions with those colleges, and we are looking for reciprocity. So fingers crossed. That would mean actually you could take our exam in your own country and region at less cost, and then move on through their system as well. So
thank you. What are the fees?
Sorry.
PK, I have questions.
1 second, Cuckoo. Could you just
Yeah.
confirm the fees, please?
Yes. Well, I graduated from University of Edinburgh, and one of my friends, my colleagues there, has already passed the clinical examinations of International Ophthalmology Foundations. So he asked whether there is any opportunity in the next future, in the near future, that IOF will be coordinating with uh, Royal College of Surgeons of Edinburgh. So people who pass the test of International Film Foundations can proceed into the FRCS ED maybe.
Yeah, that's what we're looking for. So that's what we hope to achieve. We've got a meeting with Glasgow tomorrow, so we hope that's successful. And that means that you can take our exam and move through the Glasgow system. And
Yes.
we hope to do that. We've had discussions with Edinburgh, and we hope to do the same with that. It's not guaranteed, but obviously we're looking at collaborating with those two. So fingers crossed.
Yes.
Vicky, sorry, I think you asked about fees as well.
Yes, please. Yes.
So the visual sciences is $250, optics and refraction is 175 US dollars, and clinical is 350 US dollars.
Thank you. Next question. What is the revision period the revision time that you suggest?
Funny question. It's a good question, but funny question. It depends on how you feel as an individual. I think I've worked in examinations for over 20 years. I've seen candidates that are extremely confident, but haven't been successful, and I've seen candidates that are not so confident and have achieved top marks. I think it depends on how confident you are, but a revision period, I believe you need 3 months. It also depends on your family that you've got around you. If you've got young children, then obviously 3 months maybe not. You're trying to navigate life as well. You might have a fellowship somewhere. So I think it depends on where you are in your training and what you're doing. We recommend that you take the visual and optics between your first and second year of training, and then the clinical sciences from year 3 upwards. But then I've had candidates who have taken their clinical in their second year and been successful. So it depends, but I think you need to be realistic, and 3 months would be my recommendation.
Thank you. What study sources do we supply?
If you go onto our website, there's a suggested reading list, so you'll find all the resources on there. If you're looking for something specific, then let us know, and we will speak to one of our specialists who can direct you. We're working with CyberSite, who's part of Orbis, on a preparation tool, but that won't be available for a few months. But yeah, I mean, the questions are mapped to the BCSE. So the reading list supports the BCSE, so you don't have to go and purchase that, but it's all available on our website. Kiku, I think you had a question.
Yes. Can I share some things to attendees using bahasa Indonesia maybe? I'm so sorry.
Yeah, of course.
Oke, mungkin buat teman-teman yang banyak bertanya mengenai sources of reading list and so, sebenarnya banyak pertanyaan itu memang sangat-sangat tercantum tuh sebenarnya di reading list yang biasa kita baca kayak AO dan sebagainya. Memang seringkali yang jadi problem ketika saya tidak lulus tes, when I didn't pass the test, adalah ketika a lot of detail information itu sebenarnya yang miss karena faktor waktu antara saya lulus dengan saya mengikuti tes ini. Yaitu seperti misalkan really Wolffield syndrome dan sebagainya yang sebenarnya sudah dibahas di AO tapi sudah lupa. Jadi I encourage all the young ophthalmologists to take these examinations, these international examinations as early as possible because ketika kita sudah belajar membaca pada saat kita lagi proses residensi, mungkin informations yang kita retain dalam memori kita itu akan sangat banyak dibandingkan kalau seandainya kita sudah menjadi seorang ophthalmologist yang cukup lama. Bukan berarti kalau seandainya di masa saya mengambil tes ini, berarti artinya terlambat gitu. Jadi kalau bisa sih sebenarnya as early as possible, please do. And the reading list would be not so much differ from our reading list from our residency program. Thank you, Vicky, Nicola.
Thank you, Kia.
Okay. So we have one more question. Is there a
Yeah.
maximum limit you can take the exam?
Yes.
No. We'd all like you to pass first time, but that's obviously not in some cases. But no, there's no limit. And I think, as Kiki said, like, you know, don't try and not get disheartened. I know if you're not successful in the first attempt, it's disappointing. But I think, it is a hard exam. It is an international exam. And I think, with the right preparation and, try and be positive, try and be confident, believe in yourself, which I think helps going into an exam. I know it's nerve-wracking, but I think it's achievable. I mean, as you said, and you mentioned it, that you took the exam, but you were so close. And you did really well. And I think you should believe in yourself. So I would put out there that there are no limits. But I believe that you will pass in possibly your second or third attempt going in. And as I said before, we understand that you're working medics. There are other elements around you. There's work, there's life, there's family, which and they take priority, obviously. So yeah, I wouldn't be too disheartened. But yeah, there are no limits.
Thank you. We have one more question, but I think this may be a fellowship question. Is the fellowship exam specific to the field I choose? So, for example, if a candidate was to choose pediatric ophthalmology, will the exam focus solely on that field, or will it cover a broader range?
No, so the visual optics and clinical cover a broad range. As I said, we're implementing subspecialty exams, and they'll be obviously more specific. I think there'll be 120 questions in each exam. So retina, if you're specialising in retina, you could take 120 questions in September. I think if you're looking to go through to fellowships and you want to take retina, then obviously you'll take the retina subspecialty exam, but it will be a requisite that you pass the clinical to do that. So I think those subspecialty exams will make you stand out. I think fellowships are really competitive. When you fill out an application form, you need to make yourself different because that's what people look for. And you get points. You get points for passing our exams. You do get points for passing other exams, but you'll get more points for passing the Ophthalmology Foundation exams. And then you'll get points for your outside activities, your interests, your presentations that you've done, where you've worked. If you've gone and traveled to another country on your own accord and done some work there, it's your experiences. So I'd fill out the application. I would say read very carefully the application. Don't rush it. Give yourself enough time. And hopefully you'll be successful. But with the subspecialty exams, you will get extra additional points. So if you're looking to take a retina, for example, fellowship, then passing the retina exam is obviously going to not go against you. It's going to go for you and make you stand out from someone that maybe hasn't passed it. But you do not have to pass our exams to apply for a fellowship. Let me just make that clear. You can apply for a fellowship at the moment without passing our exams. I'm not sure that will be the same in a few years' time. There are discussions, but at the moment you don't need to. So I just want to make that clear. So I don't want you to think you can't apply for fellowship. But yes, obviously, what you have a saying here, I don't know if you have the same saying, that points make prizes. So the more points you have, the more chance and prize you get.
Thank you. One more question has just come through. Once the candidate has passed the clinical exam, are they able to use the postnominal FIOF next to their name?
Yes, so once you're successful, you will be awarded FIOF, Fellow of the International Ophthalmology Foundation, which is a great achievement. We offer pass, merit, and distinction. So if you're in the top percentile, then you'll be awarded merit or distinction. And then we have a fantastic certificate. it's a high quality paper that we ship out to you. It have your name on it, have that you've got FIOF. It's got a hologram. It's signed by the president of the OF and the head of examinations. It's hologrammed. It's embossed. And I think if you achieve it, you should be really proud of it. We've got a lot of our passees that have shown us pictures of being presented in their own country, and then put up on their wall in their office or their institution. I think as well, I said it's really nice. I mean, Turkey, we've signed an agreement with the Turkish Ophthalmic Society, and they're encouraging their trainees to take this exam, and they're going to award themselves the top passing candidate from Turkey. So I think there's also that element as well that your institution or your society can get really involved and support through the process, and that's quite exciting. And we have social media for the Ophthalmology Foundation and platforms that we can promote that on. And again, I think it builds, collaboration between and makes ophthalmology a smaller community, a large community smaller, that we're all connecting.
Another question we have, and I believe, trying to read it, that a candidate may have passed ICO subspecialty. Do they exempt them from any of the examinations?
I think so they don't exempt. I'm assuming if they've passed subspecialty ICO, they would have taken the ICO exams previous, so the clinical. So I'd be interested to know if they want to email me, then I can look at that and then get back to them.
Thank you. Last question so far. What social media platforms do we have so they can contact?
Rose is a specialist in this. I think we have Instagram, Facebook, LinkedIn.
Yes, and then all of our webinars and other videos about information about the Ophthalmology Foundation are on YouTube as well.
Excellent. Thanks, Rosie.
I think that we're finished with the questions, so we can continue. Thank you. Cuckoo, do you have anything else you'd like to add?
No, but if you give me a chance, let me emphasize one more things untuk teman-teman semuanya. Mungkin memang it is not mandatory part we need to take international examinations, tapi percayalah bahwa this is membuka banyak sekali peluang untuk more fellowships and educational opportunity di luar negeri yang akan acknowledge oleh banyak board member di luar negeri. Jadi kalau bisa sih, saran saya, please don't hesitate to take these examinations. Started with the very visual optics and so. Kalau memang nanti bisa dilanjutkan terus sampai ke level subspecialty. Teman-teman, saya berharap mungkin teman-teman dari YO bisa ambil examinations international ini. Thank you, Vicky.
Thank you, Cuckoo. There's one more question that's come through, Nicola. Will the 40-year-old age cap be removed in the future for fellowships?
That's a really good question. I can't answer that. I'll be completely honest. I don't know. The best person to speak with is Cordula Obermeyer. But we can put that question to her and get a response, and then we'll let Cuckoo know, and then Cuckoo can distribute the answer to the question if that's okay. And we work closely with fellowships, but I wouldn't like to answer that question unless Cordula was present. But it's a good question.
Thank you. And we are finished with the questions. Thank you for everybody. Sending the questions.
Thank you, Vicky, and thank you everyone for attending today. It's been great to run through all of your questions. We will send out a recording of this webinar to everyone through our YouTube, so keep an eye on your emails, and if you have any questions, you can reach out to us at any time.